Congratulations! Welcome to day 1. All throughout the training, you will be introduced and exposed to the 6 framework for providing quality care. The 6 principles are: keep the person safe, practice infection control, protect the person's dignity, foster the person's independence, protect the person's privacy, and practice good communication. Please refer to page 13 and 14 in your book. We will highlight this framework as you begin to unfold the art of being a nursing assistant. In this video, we are going to discuss Chapter 1, Being a Nurse Assistant. A nurse assistant works under the supervision of a nurse, registered nurse, RN for short, licensed practical nurse, LPN, or LVN for short. As a nursing assistant, you will be caring for people who are ill, injured, or disabled. As part of the team, you will meet the person's physical and emotional needs. A big part of your job will be helping the people you care for and their activities of the daily living, ADLs for short. This includes eating, bathing, dressing, grooming, using the toilet, and many other activities that the individual may need assistance with. Nursing assistants are also responsible for obtaining routine measurements. For example, vital signs, blood sugar, height, weight, transfers, admissions, and discharges. In addition to meeting the needs of an individual physically, nursing assistant also will help them meet their emotional needs. For some individuals, it can be scary to be in an unfamiliar place. Because nursing assistants spend the most time with the person, they often will get to know the individual and can provide support of their needs. Nursing assistant is also often the first person to see the individual. Therefore, they may be able to recognize any changes like decreased appetite or if the patient is worried about an upcoming procedure. When these types of things happen, you will need to report it to the nurse so that a proper step can be made. This promotes an overall quality of care. Please refer to page 5 of your book for more sample job description of a nursing assistant. This will help you broaden your knowledge. Requirements to become a nursing assistant. Congratulations, you are one step closer in becoming a certified nursing assistant, also known as a CNA. You must complete a state-approved training, classroom learning, hands-on practice in the skills lab, and a supervised direct care in an actual healthcare setting. You will also need to pass the state certification. This includes a written test and a skill test. When you pass your competency evaluation, you will then be listed in the Massachusetts Nursing Aid Registry. Working as a member of the healthcare team. The healthcare team consists of the patient, the family member, staff members, and other professionals who are responsible for the care of the patient. You, as the nursing assistant, will be a part of the multidisciplinary team. Please refer to Table 1-1 in page 6 to 8 of your book for examples of healthcare team members and their detailed responsibilities. The nursing team. A minimum of 2 members, the RN and the CNA, the LPN and the CNA, APRN or the Advanced Practice Registered Nurse, NPs or the Nurse Practitioner, CNS or the Clinical Nurse Specialist may also be a part of the team. They will be supervising your work and may delegate a task to you. Delegation. When a nurse gives you an authority to perform a task on the nurse's behalf, for example, taking a vital sign or assisting with transfers. Please note, it is very important that you report any findings to the nurse after performing a task. It is high yield to report any abnormal results to the nurse right away. You also will need to report any task that was not completed and the reason as soon as possible. Do not delay care. In order to protect yourself, the patient, and your workplace, you must work within your scope of practice. Scope of practice means that you are performing tasks that you are permitted to do. This can vary from workplace to another. For example, some hospitals allow CNAs to take an EKG, but other hospital does not. It is very important that you follow your workplace policy. Tasks that are usually outside of the CNA's practice. Supervising or delegating nursing responsibilities to other CNAs. Analyzing or interpreting data, for example, obtaining a blood pressure, the CNA determines that this is out of range. There may be a reason behind the abnormal finding. This is to be determined by the doctor or the nurse, not the CNA. receiving or taking verbal orders like critical lab results, new medication orders, diagnosing illness, injury, and prescribing treatments, administering medication and oxygen, inserting or removing medical equipment such as Foley's, disconnecting IV tubings. Healthcare settings. As a CNA, you will have the opportunity to work in many settings within the healthcare system. For example, acute care settings. These are hospitals. Normally, the patient would stay inpatient in the hospital. Inpatient means that they have been admitted to the hospital versus outpatient, where the patient goes to the hospital for a one-day surgery and goes home right after. Example of acute care settings in Massachusetts are Boston Medical Center, Beth Israel Hospital, Brigham's and Women's Hospital, Massachusetts General Hospital. Subacute care settings. These are facilities that provide care to the patients after they leave the hospitals. For example, Spaulding, Braintree and Compass Health, and Alliance Health. Long-term care settings are facilities that provide over extended period of time. Examples are South Cove, Boston 1, or Marion Manor. Now you have learned some examples of healthcare settings. Did you know that a CNA can work in a home setting? Some patients are able to go home but require minimal care. Please refer to page 9 to 13 for more information about healthcare settings. Overall, as a CNA, you are able to perform the skills of caregiving. However, not everyone will be able to perform those skills with kindness, empathy, and compassion. So always remember, treat the person as you would want your loved one to be treated. Again, congratulations on your decision to join the healthcare team. And on behalf of Dean Karen Manning and the rest of the faculty staff, welcome to Quincy College.